Today we are going to discussing about the measures to overcome malnutrition in India. There is a need of an integrated approach to solve all these problems presenting in our country. We need to understand what is malnutrition. Malnutrition, we already learned. Malnutrition is refers to deficiencies, excess, or imbalances in a person's intake of energy and nutrients. India faces a double burden because undernutrition persists alongside rising overnutrition, so creating complex public health challenges require integrated response. The double burden is called because there is also undernutrition and also overnutrition. An integrated approach is required here. Undernutrition means that it includes tending, wasting, underweight, and micronutrient deficiencies. This all affecting child growth and development. The overnutrition means overweight, obesity, and diet-related non-communicable diseases, including diabetes and cardiovascular conditions. We can see causes of malnutrition. There is two types of causes. First one is immediate cause. Second one is underlying cause. Immediate causes arises as immediate or present due to present condition like that. For example, inadequate dietary intake or disease or infections that lead to malnutrition like diarrhea, chronic diarrhea, or communicable diseases, TB like that. This all reduce nutrient absorption and increase in nutrient losses. These are the immediate causes of malnutrition. The underlying causes means food insecurity. It is present in that region or a country, and poor maternal nutrition. Poor maternal nutrition decline the uh, result in malnourished mother. It causes a malnourished baby. The poor infant feeding and poor sanitation leads to infectious diseases. Limited healthcare access. These all conditions create a malnutrition thrives. These are called underlying causes. These are persistent in region or society or community. Malnutrition in India stems from a complex web of causes at multiple levels. Basic causes include poverty, illiteracy or unemployment, gender inequality, and also environmental factors that limit resource access. These drive underlying causes such as food insecurity, poor sanitation, which in turn produce immediate causes like inadequate dietary intake and diseases. These are the multi-level causes to rigorous and integrated interventions across sectors to remove malnutrition. So this is the need of integrated approach. The causes are lying in multi-sector, multi-level of the causes lead to malnutrition, not a single one. So it requires an integrated approach. Overview of measures to overcome malnutrition we have to address. The India's malnutrition crisis requires coordinated multi-sector interventions spanning food systems, health services, education related to health and welfare, and social welfare to ensure sustainable nutritional outcomes. First one is strategic intervention. Strategic interventions means the food security, balanced diet promotion, nutrition education, maternal and child nutrition support, micronutrient supplementation, and food fortification initiatives. All we can do. We can confirm the food security of the region, and we can promote balanced diet, and we can give nutrition education through Anganwadis, Asha workers like that. And maternal child and nutrition support we have to give one. And micronutrient supplementation for uh, severe one like iron supplementation, calcium supplementation like that. And food fortification in this we can give for prevent certain micronutrient deficiencies. Second one is nutrition focused measures like that water, sanitation and hygiene. This is called WASH. And healthcare services, poverty alleviation programs, and women empowerment and community participation. These are the nutrition focused measures. And supporting sectors are enabling environment that support sustain nutrition improvement at household and community levels like Anganwadis. Ensuring food security means the definition for this is Food security means it is an access to sufficient, safe, nutritious food at all times for all individuals. The key measures for food security are: first one is main important one is improve agricultural production and reduce post-harvest losses, strengthen public distribution system PDS like Rashingada or Magli store like that, and also improve food storage and promote diversified farming. This is all by this we can ensure food security in a country or a region. Food security forms the foundation of overcoming malnutrition in India. To ensure reliable access to nutritious food, reduces hunger, improves dietary diversity, and enhances overall nutrition status across vulnerable population. Our goal to celebrate World Food Days for to ensure food security all over the world. Nutrition education means promoting healthy dietary behaviors. The main areas of nutrition education, first one is balanced diet. And next we can teach them to healthy cooking methods um, avoiding avoiding losses of nutrients due to cooking methods or uh, declining the quality of food by cooking methods, and also food hygiene and also breastfeeding, the complementary feeding in case of infants, lifestyle modification for better health outcomes. And also, the benefits of nutrition educations are better food choices. There are going to be select and prevention of nutrient deficiencies by getting knowledge about balanced diet, then improved family health, and also it can be reduced burden of malnutrition across communities. So promoting healthy dietary behaviors is essential for preventing malnutrition. Education empowers individuals and families to make informed food choices, adopt safe cooking practices, and ensure proper nutrition at every life stages. Maternal and child nutrition means maternal care. Maternal care is included antenatal care and iron and folic acid supplementation, calcium supplementation, nutrition counseling for mothers. The infant care include early initiation of breastfeeding and giving them colostrum, and exclusive breastfeeding for 6 months, and timely complementary feeding, and continued breastfeeding up to 2 years. The healthy mother is healthy child. Maternal nutrition deficient directly influences infant outcomes. So, proper care during pregnancy and optimal infant feeding practices form the foundation for reducing malnutrition and improving child health outcomes in India. Next, we can discuss micronutrient supplementation and food fortification. This is for preventing hidden hunger through targeted intervention. Hidden hunger means this is the deficiencies of micronutrients because it called hidden hunger because so when any person is healthy weight or required weight and height, he seems to be normal and healthy. But it may be there is a vitamin D deficiency or iron deficiency or a magnesium deficiency. We can identify by looking or it will not be visible. So this is called hidden hunger. We already said a double burden. Double burden means there is a presence of overnutrition and also my malnutrition. This is called a double burden. This word is hidden hunger. Hidden hunger means deficiency of micronutrients. So, how we can prevent this? First option is supplementation. Supplement iron, folic acid, vitamin A, zinc, and vitamin D uh, to address specific deficiencies in vulnerable population, including children, pregnant women, and adolescents. Food fortification can do by iodized salt. You know that salt is fortified with iodine. As iron fortified rice. Rice is fortified with iron and also fortified wheat flour and milk. Milk is fortified with vitamin C or vitamin D like that. And edible oil to improve micronutrient intake across the general population. Micronutrient supplementation and food fortification are cost-effective strategies that prevent hidden hunger, improve immunity, support healthy growth and development, and reduce the burden of deficiency disease in India. Water, sanitation, and healthcare is called by WASH. WASH components are safe drinking water and proper sanitation and washing practices and waste disposal are essential to prevent infections and support nutrient absorption. The healthcare components are immunization, growth monitoring, but also deworming, and early disease treatment to protect vulnerable population and improve health outcomes. We know that they have improper sanitation or poor hygiene resulted into disease, infectious disease, result into malnutrition, and it will lead to poverty. So, wash and healthcare interventions are critical to reducing the burden of malnutrition in India. Clean water and sanitation prevent diarrheal diseases that impair nutrient absorption, while immunization and deworming reduce infection-related nutrient losses. Together, these measures create an enabling environment for improved nutrition status across all age groups. Next, we can discuss poverty alleviation programs and also women empowerment programs. These are the integrated social measures for nutrition security. Poverty reduction strategies include employment generations, self-welfare, social welfare schemes, skill development programs, and livelihood initiatives that improve household income and food access. There are many programs that initiated these all things under the government scheme. You will learn that in coming modules. Next is women empowerment. Women empowerment means education, economic independence, decision-making role, nutrition awareness that enables women to lead a healthier family. An educated woman about a woman who is getting a nutrition education and health education, uh, it may lead to a healthier family. Social intervention play a vital role in addressing malnutrition in India. Poverty alleviation strategies improve household food access by increasing their income. And while women's empowerment enhances nutrition decision making and child care practices, that means the choices of foods, what is eaten, what food is given to child, and how can be cooked and how can be eaten like that. The empowerment enhances women empowerment enhances nutrition decision making and child care practices. This together, these approaches together create a sustainable improvements in family health outcomes. Community participation means the activities like nutrition awareness campaigns, kitchen garden making, mothers groups like growth monitoring, and village health sanitation and nutrition committees. These all include a community participation in interventions. The importance of community participations are it enhances program success and sustainability of these implementation and community ownership of nutrition initiatives. Community participation is essential for effective nutrition interventions, a local engagement through awareness campaigns and mothers group fosters behavior change. Kitchen gardens improve household food security and growth monitoring and village health sanitation nutrition committees ensure accountability and sustained program impact the grassroots level. Yeah, we can discuss what are the major nutrition programs in India. India implements several national programs to combat malnutrition across different age groups and population. These initiatives address food security, micronutrient deficiencies, and nutrition education through targeted interventions. ICDS and Portion Abhin. ICDS, we know that Integrated Child Development Service and Portion Abhin. These all supplement nutrition for mothers and children. The two, both the Portion Abhin and ICDS focus on mothers and children. Portion Abhiyan targets reduction of stunting, wasting, and anemia among children and women. PM Portion and PDS delivers nutritious meal to school children and also PM Portion delivers nutrition meal to school children as a part of midday meal program. PDS ensures food security through distribution of subsidized grains to eligible households like ration gadas and also Maveri store. Other key initiatives is Anemia Mukta Bharat prevents and controls anemia. And also National Iron Plus initiative provides iron and folic acid supplementation. And Eat Right India promotes healthy eating habits nationwide. We have a question like that. Why an integrated approach is needed? Because this is the causes are the interconnected and these are the complex causes and interconnected causes lying in a multi level. So malnutrition in India driven by poverty, poor health care, inadequate sanitation, low education levels, gender inequality, climate change impact, and also persistent food security. So, to conclude, multiple sectors must collaborate to effectively address the complex multidimensional cause of malnutrition. Single sector intervention are insufficient to tackle malnutrition. No single program or policy can independently overcome and intertwined social, economical, and environmental factors. Health, agriculture, education, water and sanitation, and social welfare sectors must work together to create sustainable testing environment in nutrition outcomes across India. Stakeholders in combating malnutrition. These are the key partners. What are the key partners in driving the integrated approach? In- First, we can look institution and services. First one is government. Government is for policies and nutrition programs. Next, health professional. They provide nutrition assessment and counseling. Next, agricultural sector. They in this sector, food production happens and diversified crops are formed, produced. In case of schools, nutrition education and school meals are provided. When come to communities and families, there is NGOs. They give awareness campaigns and community support. In case of family, provide healthy dietary practices and child care. VHNC's local monitoring and programming implementation is done by VHNCs. Combating malnutrition requires coordinated efforts across multiple sectors. So each stakeholder brings unique expertise and resources to address this complex public health challenge effectively. Finally, we have to check what are the benefits of an integrated approach. An integrated approach to malnutrition combines efforts across health, agriculture, education, and social sectors to create a sustainable, wide-ranging impact on public health and nutrition outcomes in India. So first point is to address root causes. To tackle poverty, food insecurity, poor sanitation, and gender inequality. It's lying as underlying causes of malnutrition. So it can treat rather than treating symptom. It can the underlying causes is need to remove. So address root causes is can be done by integrated approach. Next, to improve health outcomes enhance maternal and child health, and reduces micronutrient deficiencies, and prevents infectious diseases through coordinated interventions. And next, broader social impact. It strengthens food security and improves workforce productivity and promotes health lifestyle and advances India's progress toward the sustainable development goals. Thank you for listening to sessions and comment your questions and uh, discussions.